So I do have some questions. I'll be using my little iPad here. One of the first ones, and I think a few of you could probably step in to answer this, would be how do you get into patient advocacy professionally? And do you have any tips for getting into this as well? I don't know who'd like to go. I'll put you on the spot and see who'd like to go first.
I'll start because Maggie Buckley corrected me earlier. There is an EDS Society ECHO program for health advocates, so it's on a rolling basis, I guess. It's too late to register for the coming program, but it will be ongoing. So keep an eye out for that for future programs. That's what I'll say. And then I'll allow the patients to speak, probably a better experience than I.
I don't know if I would consider myself a professional advocate, but I think for me in finding my voice and I was diagnosed at the end of 2019, and then it kind of went downhill really quickly for me. And I think it was just a survival process for me to be able to literally save my life and have to step in when doctors and nurses had never heard of EDS or POTS. So it's a mix of creating awareness, but also being an advocate for me.
Yeah, I would agree. And it's more so just jumping in with both feet because you have no choice.
Yeah.
Yeah, it's sink or swim, right?
Yeah, sink or swim. And then for me, trying to do it on a larger scale now is because I see that there are so many people that may not be able to raise their voice, or they're just so tired. Like my mom, she's just like, I'm exhausted. Like you'll tell me something, not me specifically, but she'll hear doctors tell her something. She's like, I just want to roll over and go to bed. Like I'm over it. So for me, I have that drive, that desire to help others who may not be able to have the energy to do it themselves.
I think for me, because my work professionally is advocacy for other people, I think it came to me easier to navigate the system because that's what I do for my clients on a regular basis. When I really fought at the end in 2021, before my diagnosis, I wrote a very strong worded email to the rheumatologist who was fixated on the fibromyalgia diagnosis and said, like, you need to do something. I need help. And it turned out to go through a pathway that did eventually get me some help and the help that I needed. But it's a lot of energy, it's a lot of work. It's really not for the faint of heart, and not everybody can do it.
Yeah, absolutely. Thank you. This one is for Drake. Someone would like to know, who did you see? Who was the Quebec chiropractor? On the spot there, if you can remember.
So it was Dr. Isabelle Cazot in Prévost, Quebec. And I think Clinique Santé that's the name of her clinic. Her and her husband are both Atlas orthogonal practitioners. He's in Montreal and she's in Prévost. So it's Dr. Isabelle Cazot.
Brilliant, thank you. And to Claire and Dacre, in healthcare systems where you don't receive specialist support beyond the diagnosis of HEDS, how can you effectively advocate in primary care for additional management strategies such as medication, PT, OT, POTS, MCAS, etc., when you're told there are no options?
This is very challenging. This is very challenging. I think, is my mic on? Yes. I think the key is finding an advocate in the system. And it doesn't have to necessarily be the primary care doctor. It can be a rheumatologist. It can be a physical therapist. It can be anybody who's willing to reach out to their colleagues and find the people that you need, because you just kind of need a shoehorn almost into the system. And sometimes there are nurse practitioners in offices that are willing to take that role, and So finding that person and having the perseverance and just kind of sticking with it and reaching out to other people in your community who may have had success and finding those folks and then finding the people who are helping them can often be very helpful. It's just as Drake was saying, not giving up. You have to kind of stick with it and know that there is a way in. It's just you have to find it.
Yeah, absolutely. And I think that word community is so key as well, that we're all part of it and to lean on
We're
each
all
other.
pioneers. Every person in this room is a pioneer.
One thing I find I'll speak on Claire's behalf too, which I followed her lead in this, which she does such a good job, is maybe why she gets compared to David Bowie. we begin, as she will say herself, we begin to start taking on some skills that we may have not been trained to do. So whether it's managing POTS, managing medications for mast cell activation syndrome, it's something it's upon us to start to learn how to do when we don't have the specialty access that is needed for our patients.
Yeah, I know more about treating mast cells now than I did absolutely when I graduated from medical school, that's for sure. But I consider what I start off with in managing mast cell, I call that my mast cell 101. Yeah. I have my couple of things that I try. Yeah. And sometimes that's really plenty to really make a significant difference for people. But if they need the graduate course, then we have to find an allergy immunologist, and it's the same thing for most of the comorbidities. I have a basic level of approach, and I think a lot of the people who are running multidisciplinary clinics are in similar situations now. And what we're hoping is that the core network is going to provide more and more of those resources available for people around the country and around the world to make that kind of expertise available.
Absolutely. It's wonderful. Thank you. Another one that's, again, can kind of come under everyone and your own personal experiences. So how does one proceed after being gaslit from a previous organisation as a child and diagnosed that they do not have HEDS? And when the symptoms have become worse, they would now fall within the HEDS criteria as an adult. So kind of told, no, not a chance, that's not what's going on. Clearly is. Where do you begin? How do you get back into it? It's taking that big step, basically.
I could speak on that through experience and others that I've learned from, is whenever you bring an issue to a doctor and you feel very dismissed by them, say, do you mind writing that down in my record, stating that you don't see the need to look into this any further, and then have them sign off on it, and you sign off on it. And request a copy of it, because they'll change their tune real quick. A lot of times, because I've only really recently started doing this over the last couple of years, and I have been able to get further investigation that did prove what I suspected things to be by doing those things.
Absolutely.
It's definitely not an easy process. For me, I was born with a dislocated hip and told that I was double jointed, and it still took until I was 38 to get some answers. But what I found for me is, like I had mentioned, doing the emotional work, which allows you to be able to step in and show up as the expert, because you really are the expert of your own body. And I think that mindset shift made a huge difference for me to be able to go and not be dismissed and say, no, this is what I'm experiencing, and push for answers.
For me personally, I've been on this real journey for 55 years of learning how to love myself. And if you turn in after all of these experiences and just, Dr. Clair, you say this all the time about meditation and breathing and things like that, but sometimes you just have to breathe. And then when you breathe and you meditate a little bit and you turn in and you consider yourself for a moment, stop considering all of the people that are saying no and think about you just for a moment. Give yourself a break and take that breath that Dr. Clair always says that we need to take. She told me the other night I was dying over there before I get up to sing, and she's like, just take a breath. So I did, and I don't know me, I was like, oh God, Dr. Clair is like, and she's like, Calgon, take me away, right? She was, it was like the best thing ever. I mean, back to the David Bowie thing, I'm telling you, Dr. Clair, not David Bowie. But you really have to, like, you have to really love yourself enough to push and to keep going. But just take that breath and re-energize yourself, and then move forward again.
Absolutely.
You're worth it.
Yeah.
You are.
Yeah.
Yeah.
Have anything?
I mean, that's what I was going to say. You need to have that burst of energy. That's what happened for me too. In 2008, and then I lost it, and then I had another burst of energy after that. And it takes a long time to seek answers. Obviously, we all know that. But you do need to keep going back, and you do need to have some frank conversations with people. You do need to make sure that they're actually listening to you. And I find a really good piece is when you're talking about quality of life to practitioners, because that's when they start listening to you. So I'm sure a lot of us can relate to not having quality of life at some point along this journey. And that for me was when I really got through the red tape.
And I mean, the worst case scenario is they're just going to say no, but they already did.
Yeah.
So you might as well stand up and say, like, raise your voice about the things that are going on. Because, again.
And I think it's important we often find it much easier to advocate for others than it is to advocate for ourselves and to show ourselves the same kindness and to step forward with that. I think it's incredibly important.
I think community, because of that, has also helped been able to advocate. Because I've learned so much from other people with EDS and POTS. So community has been huge too for me.
With that in mind, I think it's also really helpful to have somebody with you in the appointments and not be there alone, especially with doctors that you may not have met before and you don't know what kind of reaction you're going to be getting. So to have somebody who can speak on your behalf, sometimes that's easier than advocating for yourself.
Absolutely. That support is so important.
I know one thing that I'm going to be going back when I get home and talking to the community that I have in Ottawa is that they're behind the scenes, people really are working towards understanding and better treatments and all of that. Just hearing from the people this weekend from places all over the world. As patients, we don't necessarily get to see that. We only see what, I guess, all the closed doors in front of us, not necessarily what's in the background. So the fact that I can now go and be like, hey, this is what's going on. These are the programs that are happening. There was a new app that was just launched called Guava that is integrated with your family doctors and patients to help with your care. But when I asked them how is that being brought forth into the community with patients or physicians, it's just word of mouth. So, but it's just been a huge eye-opener for me specifically to see that there is so much going on behind the scenes and that it is not just here in North America, but worldwide.
Yeah, absolutely. And like I said, the more we chat, the better it can get.
And that's why things like this are so important, and what the EDS Society does for all of us is just so vital. When I found the EDS Society, it was a resource, and now I feel like I found a whole other family.
Absolutely. Definitely. We can probably, what's the time? We could squeeze in another question. Let's do it. Scrolling on my iPad, hang on. You've all thrown me because it's also lovely to hear everything. I'm looking, I promise. Again, probably more for Claire and Dacre potentially. Where can patients turn when they've already been labelled with benign hypermobility but continue to face serious issues such as gastro problems, syncope and other symptoms, and doctors are still saying it's all in your head, it's all psychological? Off you go.
Well, take Drake's story as inspiration. You don't give up, okay? And again, I mean, that's what is so inspiring to us, is that those patients we see, they haven't given up. They've had so much courage to do it. But and just share in this discussion, your body doesn't lie, right? No matter what misinterpretation or misdirection you've been given by doctors in the community, your body's not going to lie to you. You know what your gut feelings are. You know something's not right. And this is where you then become empowered by getting involved in the networks where the patient advocates, where the health advocates may be able to identify you, reach out to you, and bring you up and bring you to the right people. And that's why that role is so important.
Yeah, and I think finding those resources online, all the information, there's a tremendous amount of information on the Ehlers-Danlos Society website, the professionals directory that's on there, and just a plethora of information and the resources that are out there. You know, Dr. Linda Bluestein's, I can't even start to mention all the YouTube videos and things that are out there. So there's a lot of information for you to find online, and just keep digging, and you'll eventually find the resources that you need.
Well, thank you all so much, everyone on the panel today, and obviously the star of the show. It's been amazing, but thank you all very much, and we'll hand over to Lara now.